Diagnostic laparoscopy is a surgical procedure used to diagnose endometriosis, a condition in which tissue similar to the uterine lining grows outside of the uterus. While laparoscopy was the most used diagnostic tool, it is not always the best way to diagnose endometriosis. The following are some of the reasons why diagnostic laparoscopy should not be used to diagnose endometriosis. Laparoscopy is a surgical procedure. A laparoscopy requires the surgeon to make a small incision in the abdomen and insert a laparoscope, which is a thin, flexible tube with a light and camera attached to it. This can be uncomfortable for the patient and can lead to complications such as infection or organ damage. Laparoscopy may or may not provide a conclusive diagnosis. While laparoscopy can be used to visualize the uterus and other abdominal and pelvic organs, it does not always provide a definitive diagnosis of endometriosis. Tissue biopsies may be required in some cases to confirm the diagnosis. Laparoscopy is not always required. Endometriosis can be diagnosed using non-invasive methods such as imaging tests or pelvic exams in many cases. These methods are less dangerous and can provide a diagnosis without requiring surgery. Laparoscopic excision may not be a permanent solution. While laparoscopy can be used to remove symptomatic tissue or scar tissue, it does not always provide a long-term solution for endometriosis. In many cases, the condition will reoccur after the procedure. Surgery can be an option in some cases for endometriosis, but not all endometriosis is the same. Sometimes surgery can worsen the symptoms, especially neuropathic pain. Check the endoblocks section on Mind Me Endo for more. Planning the surgery if needed by appropriate history taking, examination and ultrasound or MRI is paramount. Laparoscopy can see the tip of the iceberg with the rest hidden. Having an ultrasound or MRI beforehand means these areas will be seen, surgery will be planned, and you will have information about risks and benefits and realistic chances of improvement or none. While diagnostic laparoscopy was considered an effective tool in the diagnosis of endometriosis, it is not the best option. Non-invasive methods can provide a diagnosis in many cases without the risks and complications associated with surgery, and they can provide information about areas in your pelvis that cannot be assessed via a laparoscopy. If you are thinking about having a laparoscopy to diagnose endometriosis, talk to your doctor about the potential risks and benefits as well as all of your diagnostic options. Check mindmeendo.com for more information.